Hi, David Silverstein here with BrokenHealthcare.org, where we're changing the American healthcare system one step and one bill at a time. Today, we're going to talk about what is really ultimately wrong with the American healthcare system and what we need to do to set it on the right course. Look, there's a lot of debate about what role government should play in healthcare, but the truth is that we don't have a functioning system right now. And without a functioning system, we can't know what the right role of government is to play. We can't know what market forces are or are not capable of doing. So what I want to do today is I want to lay out for you in simple terms the way the healthcare system currently works and why it's a dysfunctional system. If you think about most marketplaces, the relationship between customer and supplier can be illustrated with a very, very simple picture. Really, it's just a straight line with two arrows between the customer and the supplier. And the customer somehow has to discover the price that the supplier wants to charge. That supplier could be a business-to-business manufacturer. It could be a retail operation. It doesn't matter. But the customer has to discover somehow the price that they're going to pay and then make a decision as to whether or not they want to pay that price. And if they don't, the supplier has to decide whether or not they want to adjust that price in order to woo more customers. Price discovery happens in one of several ways. First, it can simply be what we call transparent pricing, where the price is available whether online or just posted on the shelf next to the item. Other systems of price discovery include negotiation, like when you go to buy a car, or some kind of a bidding process. But the relationship is pretty simple. Even for a big complicated business that has both customers and suppliers of its own, take a company like Walmart, the relationship between Walmart and its customers is very straightforward. That's based on transparent pricing. The relationship between Walmart and each of its suppliers is also very straightforward. In some cases, Walmart may have its suppliers bid to provide it with product. In other cases, it might negotiate the prices. And in some cases, Walmart may have to just go out and buy things at a listed price under the principle of price transparency, just like everybody else. And so this concept of this linear relationship, it doesn't matter if it's a business to business or a business to consumer relationship, it's easy to understand, and the price discovery is the foundation of what drives the price that the customer in each relationship will ultimately pay. Well, in healthcare, unfortunately, we have a very, very different system. We don't have a two-way linear relationship. What we have is a three-way relationship with the payer or insurance company and the medical provider getting together under some kind of a business-to-business relationship where insurance companies negotiate with the hospital, with the doctor's office, with the radiology center, with the lab, with the pharmaceutical company, or even with the drugstore. They negotiate prices. And then we have the patient. Well, the patient has sort of a business-to-consumer relationship with the medical provider, although the price that the patient is capable of paying is often unknown to the patient and is determined by their insurance company. So it's not really a true business to consumer B2C kind of relationship, except sometimes when the patient is paying the bills directly, whether it's an uninsured patient, maybe it's an out-of-network provider that they're going to. And then, of course, on the other side of the triangle, we've got a relationship between the patient and the insurance company that often goes via their employer or via the government. So I don't even know what to call that, a B to C to something kind of relationship. In the case of the employer-sponsored health insurance, the employer negotiates with the insurance company and is making decisions there about what they will and won't pay for when it comes to the patient's care. And then the employer chooses one insurance plan. Maybe in a big company, there's a couple of choices within that plan, but essentially it's one plan or one network that the patient is then stuck with. So the patient hasn't had the choice of insurance coverage and isn't privy to all of the negotiations. Well, what happens in this complex system here is the whole concept of price discovery breaks down. And when price discovery breaks down, patients, the ultimate customer in this case, can't really make well-informed decisions about their medical care based on price. And so we have this very complex, very convoluted relationship where the price discovery has broken down, and there's really only one way for us to fix that. Well, we could have multiple types of relationships, as you saw in the Walmart example, with um, price transparency between Walmart and its consumers and other systems that can work between Walmart and suppliers. Those are all independent relationships. In this case, these are all interdependent relationships. And because they're so interdependent, the only way we can achieve price discovery is to have full transparency all the way around the triangle, on all sides of the triangle. This is why the concept of price transparency is so incredibly important. Only once we've achieved price transparency and created a functional marketplace can we then start to have conversations about the role of government. Government does play an important role in markets, in both protecting consumers and protecting competitiveness. But we can't know what the right role of government is until we have a functional marketplace. You see, government ultimately is there to take up the slack when there are inefficiencies and things that are not working correctly. So when we're constantly having this debate about what role government should play, the truth is nobody really knows. I happen to think there's a pretty darn big role for government in the future. We're already at a point where government is paying for half of the healthcare in this system. So that government is involved in our healthcare is a foregone conclusion. We just don't know what exactly that role needs to be, and therefore we have to drive transparency on all sides of the triangle so we can create this functional marketplace. When we have dysfunctional marketplaces, what happens is we make changes to the system in a goodwill effort to fix it, well-intentioned effort, but we can't predict the behavior of the system because non-functioning systems don't behave predictably to change. So you can start to see why the ultimate solutions begin with us achieving full price transparency.